Hello and welcome. Today we're diving deep into a respiratory condition called tracheitis. While not as common as other lung diseases, tracheitis can be quite serious, so understanding its causes, symptoms, and treatment is crucial for overall respiratory health. Let's embark on this informative journey together. So, what causes tracheitis? In most cases, it's a bacterial infection, with Staphylococcus aureus being the most frequent culprit. However, other bacteria such as Streptococcus pneumoniae and Haemophilus influenzae can also be responsible. Viral infections, often stemming from the flu or common cold, can sometimes lead to tracheitis as well. Occasionally, fungal infections or even trauma to the trachea can trigger this condition. In summary, the etiological causes can be mainly broken down to bacterial, viral, and fungal infections or trauma. To understand tracheitis, it's important to know a little about the pathophysiology. The trachea or windpipe is a vital airway that carries air to and from the lungs. In tracheitis, an infection causes inflammation and swelling of the tracheal lining. This inflammation can lead to the formation of thick, purulent secretions that obstruct the airway. The swelling and secretions narrow the tracheal passage, making it difficult to breathe. In severe cases, this obstruction can be life-threatening, requiring immediate medical intervention to secure the airway and prevent suffocation. Tracheitis isn't a particularly widespread condition, but it's more prevalent in children, especially those between the ages of 3 months and 6 years. This is likely due to their smaller airway diameter, making them more susceptible to airway obstruction. It can occur year-round but may be slightly more common during colder months when respiratory infections are generally on the rise. It's important to note that anyone, regardless of age, can develop tracheitis, particularly those with compromised immune systems or underlying respiratory conditions. The signs and symptoms of tracheitis can be alarming. A classic symptom is a high-pitched, noisy breathing sound called stridor. Patients often experience a harsh, barking cough, and they might have difficulty breathing, even when resting. Other symptoms include a high fever, sore throat, hoarseness, and general malaise. Children may drool excessively because it's painful to swallow. In severe cases, patients may exhibit cyanosis, a bluish discoloration of the skin due to lack of oxygen. If you or someone you know experiences these symptoms, seek immediate medical attention. Diagnosing tracheitis involves a thorough medical evaluation. A physical examination is essential, where the doctor will listen to the patient's breathing sounds and assess their overall condition. Imaging tests, such as X-rays or CT scans of the neck and chest, can help visualize the trachea and identify any obstructions. A definitive diagnosis often requires a direct visualization of the trachea using a laryngoscope or bronchoscope. This procedure allows the doctor to directly inspect the airway and collect samples for culture to identify the specific infectious agent. A complete blood count may also reveal elevated white blood cell counts, indicating an infection. Tracheitis is not typically divided into subtypes, but we can classify it based on its severity: mild, moderate, and severe, or by the causative agent, such as bacterial, viral, or fungal tracheitis. The most important distinction is whether the airway is significantly compromised, which dictates the urgency of treatment. The primary goal of treatment and management is to ensure an open airway and combat the infection. In severe cases, this may involve intubation, where a tube is inserted into the trachea to assist with breathing. Antibiotics are crucial for treating bacterial tracheitis, and the specific antibiotic will depend on the identified bacteria. Supportive care such as oxygen therapy, intravenous fluids, and pain management is also essential. In cases of fungal tracheitis, antifungal medications will be administered. Close monitoring is critical to ensure the patient's condition is improving and to prevent complications. Preventing tracheitis primarily involves minimizing exposure to respiratory infections. Practicing good hygiene, such as frequent hand washing, is paramount. Getting vaccinated against the flu and other respiratory viruses can also reduce the risk of developing tracheitis. Avoiding close contact with individuals who are sick and maintaining a healthy lifestyle with a strong immune system can further lower the chances of contracting this condition. The prognosis for tracheitis is generally good with prompt and appropriate treatment. Most patients make a full recovery without long-term complications. However, delayed diagnosis or inadequate treatment can lead to serious complications, such as airway obstruction, pneumonia, or even death. Recent research focuses on improving diagnostic techniques to allow for earlier detection and on developing more effective treatments to combat antibiotic-resistant bacteria. Scientists are also exploring novel antiviral therapies to better manage viral-induced tracheitis. Continued research promises to further improve the outcomes for individuals affected by this respiratory illness.